Our study objective was to make low-cost, easy-to-obtain new teaching models and to demonstrate feasibility. Previous models developed for this purpose have been established in high-resource centers, such as those with 3D printing capabilities. However, not all institutions have these resources. Today, we will be using placentas for pelvic dissection in the open and laparoscopic approach. Retroperitoneal dissection is a difficult technique to practice and to teach due to lack of appropriate models that mimic the tissue. The goal of this surgical dissection is to expose various anatomical structures while ensuring structural and physiologic integrity of the tissue. This skill is different than other types of dissection, as the goal is to expose tissue that is not clearly and performed near critical structures. Specific skills are necessary to perform a safe and efficient retroperitoneal surgical dissection in the female pelvis. The amnion mimics the peritoneal tissue. The underlying or interposed vessels overlying the chorion represents retroperitoneal structures, including blood vessels and ureters. In institutions practicing obstetrics, placentas are readily available. Placentas are easy to use because no preparation is needed. They are easy to gather and easy to dispose of. Despite the disposition of the placentas as waste, consent for educational purposes was obtained from patients. Our placentas were stored in normal saline or on ice and were stored anywhere from 15 minutes to 8 hours before usage. Supplies for the open approach are listed above. Dissection is performed with both hands. During the dissection, the surgeon must expose, identify, and safeguard vital structures, including the ureters, vessels, and nerves. If possible, all dissection should start from a region seemingly uninvolved by pathology and proceed millimeter by millimeter with sharp dissection. In an open approach, grasping and tenting the tissue upwards identifies an avascular plane to initiate dissection. Atraumatic DeBakey forceps are preferred to tent up the tissue. Metzenbaum scissors are used for malicious and accurate tissue dissection. Right angle clamps can be used to assist with dissection to retract peritoneum or isolate structures, such as performing hypogastric artery dissection. We did notice using a placenta that was stored for at least an hour was better for dissection than those stored less than that, as the blood had coagulated more and allowed for easier manipulation of the hypervascular tissue. Babcock clamps can be used to isolate structures. Supplies for the laparoscopic approach are listed above. Similarly, in one hand, the atraumatic graspers lift up the amnion, and with the other hand, the laparoscopic scissors can cut tissue and coagulate small vessels. The benefit of pneumodissection is not noted in this model, but it is beneficial for retroperitoneal dissection in laparoscopic or robotic approach. The placenta can be placed in a bowl to mimic the pelvis. This model can also be used in robotic-assisted surgery. As you can see, we did not use trocars. However, that can make the dissection easier. Thank you for listening to our presentation. We hope this brings a feasible, easy model for retroperitoneal dissection.